Hi, my name is Kelly Enriquez and I'm a BSN student from Florida National University. Today you guys will be observing me on how to assess a patient from head to toe. Today I will be assessing my patient Laura from head to toe. I will be using a systematic approach throughout my assessment for today. Through the interview and physical examination, I will always keep in mind to observe my patient's speech, language, grooming, hygiene, posture, gait, and ensure that her skin is intact throughout the process. I would start by introducing myself. Hi, my name is Kelly and I'm going to be your nurse for today. Then I would ask the patient for her identification, the two identifications, your first and last name.
Laura Alvernia.
And your date of birth.
4/23/87.
Then I would move on to asking the patient. So I'll begin to ask my patient, what's today's date?
December 6, 2014.
And today's time?
11:15 in the morning.
I'm doing this to assure my patient's orientation to time and place. By doing this, I could have an idea of her level of consciousness. Then I would proceed by taking my patient's vital signs. I would take her height, her weight, her blood pressure, her heart rate, respiration, temperature, and pain. And then once I'm done with that and I get the data, I will now begin to assess Laura's head. I would inspect for size and shape. I would inspect and palpate for any tenderness, bumps, lesions, any missing hair or lice. It seems that everything is normal and intact. I would move down to her eyes now. I will check, ask Laura, are you having any blurred vision?
No.
Do you wear glasses or contacts?
No.
I will start to inspect the patient's eyebrows bilaterally. I would inspect her upper and lower eyelashes. I would check for her conjunctiva, that it's pink and moist in both sides. And her sclera, that's white. I would check for the cornea and the lens as well. The eyes, I'm going to assess the patient's cranial nerves 2, 3, 4, and 6. So with 2, I would ask Laura, could you read off of this paper?
My dog's name is Shrek.
Okay. So you can do it with the Snellen chart, or you can give a patient something to read close, or you could tell her to read off of the poster up there. What does that poster say?
My dog name is Shrek.
Okay. So I will now move forward to cranial nerve 3, which is the ocular motor. It would be PERLA, equal and reactive to light and accommodation. I would use my pen light. I would come from the side. Laura, look at my nose to see if her eyes dilate and contract. Okay, so it seems like everything is normal. Then I will 4 and 6, trochlear and abducis, which is the eye movements and the accommodation to light. I would tell Laura, can you follow my finger?
Yes.
I will now begin to assess Laura's ear. I will ask Laura, do you have any difficulty hearing?
No.
Do you use any hearing aids?
No.
I will begin to inspect the outer ear for any discharge or lesions. I will inspect and palpate for tenderness or lumps. I will then inspect with an otoscope to view the inner ear and the tympanic membrane. However, today I do not have an otoscope. And at this time, I will inspect the cranial nerve 8, which is acoustic, by rubbing my fingers together to see if Laura could hear.
Yes. Yes.
I will now begin to assess Laura's nose. I will ask her, have you had any nasal congestion?
No.
Any nosebleeds?
No.
So then I will start to begin assessing and inspecting for symmetry, right and left, for bilateral symmetry, alignment, or any deformalities. I will palpate for tenderness, and I will tell Laura, can you blow out, blow in, as well as this one, to see if there's any obstruction. At this time, I will check for the cranial nerve 1, which is the olfactor. I would tell Laura, for example, to close one nostril with your finger. Close your eyes. And what do you smell?
Alcohol.
Okay. I will now inspect the inner nose. I can use my pen light as well. I would check to see if there's any polyps, any nodules, the septum, any deformalities, and I will now move down to Laura's mouth. I will begin to inspect the outer part. I would ask Laura, are you having any difficulty swallowing?
No.
Complaints of sore throat?
No.
I would inspect her lips, her mucous membranes, her gums, open up her teeth to see if there's any missing teeth, any cuts or sores within the cheeks. Can you bring your tongue out? To see if her uvula is in the midline. Her tonsils to make sure that there's symmetry. This, I am checking for cranial nerve 9, 10, and 11, which are being assessed at this point. Inspect Laura's neck. I would observe and inspect for any discoloration, any masses or lumps. I would start to palpate with my fingers, the tips of my finger, for any tenderness, any bumps, lymph nodes that are swollen, behind the ear, in the mastoid area. I would check for the lineation of the trachea from right to left, the thyroids, and I would do the range of motion. Laura, can you flex your neck, extend it backwards, and laterally put it towards your shoulder, right and left. Very well. Onto the chest. I'm going to be showing you guys the posterior part. I am going to be checking for, I'm going to ask the patient first, are you having any shortness of breath?
No.
Difficulty breathing?
No.
I will now inspect for shape, deformity, symmetry, and the skin integrity. I will start to palpate for any tenderness, for respiratory expansion. Breathe in and breathe out. Okay. And then I will start to percuss the lung sounds. I will then continue on auscultating the lung sounds. I would start in the right lobe because the right lung has 3 lobes and the left lung has 2 lobes. And I would go in a lateral form. Every time my stethoscope touches your back, take a breath in. Okay. I'm going to begin to assess the patient's heart. I will start asking the patient, do you have any chest pain?
No.
I will inspect the carotid artery and the pulsation of the jugular vein distension. You never palpate both carotid arteries at the same time, so you would do it one at a time. I'm palpating the artery to see if there's any turbulence. Then I would start to auscultate, starting in the right second intercostal space, the aortic sound. And then I would move to the left second intercostal space, which is the pulmonic. Then move down to the third, which is the mitral, and the third intercostal sternum border, and to the fourth intercostal sternum border, and then to the apical, which is in the fifth midclavicular space. So now I'll begin to assess the abdomen area. So I would ask the patient, When was your last bowel movement?
This morning?
Okay. I will start to inspect the skin integrity. I would inspect for any masses or bulges, any any redness. And in the abdomen, it's a little bit different. You will begin to auscultate first so that you do not activate any of the bowel sounds. So I would start in the lower right quadrant, and I will work my way up. So I would listen for about a minute. If I hear about 5 to 15 bowel sounds, that's in the normal range, I will move on to the upper right quadrant, which is the ascending colon, and then to the left upper quadrant, and that would be the transverse, and then to the lower bottom quadrant of the left, and that would be the descending colon. So basically, you're listening for about a minute. If you don't hear anything or anything's abnormal, you would stay in a 5-minute for each quadrant. And then you can begin to palpate to see if there's any tenderness. Do you feel any tenderness?
No.
And you would also percuss over the liver and stuff. And you would also move to the side, like that, sideways. You would also percuss over the kidneys and check for any tenderness or anything like that. Also, throughout the head to toe assessment, I am checking for the muscular system. You would check for any skin discoloration, joints, if the patient could flex or extend, or abduction and abduction for the joints. You would check for the knee reflex. You can do that with a reflex hammer. You would check the range of motion of the feet, the inversion and the eversion, the flexion and the extension. So this completes the head to toe assessment. Thank you, Laura, for being my patient.
You're welcome.
And I hope that you guys enjoyed this